Hey guys, Dr. Fred Grummelach here with SVS Imaging. We recently just had a post on imaging of the urethra where we highlighted some pathology. Now we're going to show some videos on how to get yourself in position to image that. What I always like to tell people is imagine you have a watch on your hand and you're showing it to the patient's head as you scan. So it's a twist and a tilt, allowing your ultrasound to show your view down the urethra. And what you want to see is this nice triangle sort of shape, allowing you to see that urethra as it extends caudally. And you'll see those in both of these images. When it gets more round, it tells you you're getting more into the bladder, but as it becomes more pointed as a triangle, that's highlighting you're getting down into that urethra. This is the maneuver that's going to allow you to go down into the urethra and not miss any lesions present.